Okay, testing 1, 2, 3. MUA community, can you hear me? I'm sending a test message to see if doing this Facebook Live on my iPad. I see 3 people. If that's correct, you can feel free to say hi. I'm gonna start in about 2 minutes. I'm just gonna give a few people. Hey, how are you? Okay, just want to make sure this is real. And it seems it is. For those who are on early, my name is Glen Ramsey, and I'm sitting here in Charlotte and Ross. Pleasure to meet you. Hi, MUA. I think, so right now we're about to go, we're actually live on Facebook. I'm great, and living my dream. Hi, Ken. How are you? Thank you so very much. So Ken is representing MUA on the back end from the admissions team. So if anyone has any questions regarding admissions, you can ask those questions, and I will be reading them as the Facebook Live continues, and then Ken will be able to answer those questions. Manal, wow, how are you? So I'm gonna start in just a few minutes. Assistant Director of Admissions, wonderful. So the Assistant Director from Admissions is on the line. His name is Ken. Thank you, Ken, in advance for all of your help, your support, answering the questions. And hi, Joyce. How are you? Good to see you too, Manal. Wow. Yeah. So I'm gonna get started in about a minute. I'm gonna wait till the magic number of 3 more people we got 2. Once I have 1 other person, I'm going to start. Okay, wonderful, got the number. So once again, happy Tuesday. My name is Glen Ramsey. Hi, Mr. Burks, how are you? My name is Glen Ramsey, and I am very fortunate and grateful MUA student, clinical student at this point. And I'm sitting in an office that fortunate enough was given or granted to me so that I may work in the capacity of a resident, even though I'm a 4th year medical student. Hi, Savant, how are you? Wow, one of my mentors is watching me. Wow. So I'm sitting in a room in a hospital in Brooklyn, and I just finished seeing my last patient of the day, completed all my notes, and in the process of discharging my patient tomorrow after I have successfully diagnosed this patient with a psychiatric condition called borderline personality disorder, for those who know what that means. If you don't, that's fine, you'll learn it later. So during the course of this call, I'm just going to give an overall outline as to the structure of the call, and then we can take it from there. Hi, Bree, how are you? So essentially what I'm going to do is I'm going to give you an outline, which is I'm going to just talk a little bit about myself in a very brief manner, speak a little bit about my experience at MUA, what was it like on the island, what was it like in basic sciences, what was it like in clinicals, in terms of my clinical experience, and how MUA prepared me or us for this moment, and what was it like serving and doing everything that transformed my life during the coronavirus or COVID-19 experience. So Manal has class right now, but I'm glad I made it this far. Keep it up. Thank you very much. Likewise, continue. Much success to you, Manal. So a little bit about me. I am what you call a non-traditional medical student. I had done diagnostic medical ultrasound for some years. Well, I didn't leave, but I had an amazing experience during my ultrasound experience years, where I had the pleasure of doing an echocardiogram or a sonogram of someone's heart, and as a result of that echo that I did, the patient's life was saved because I was able to make a diagnosis just before they were discharged. And at that time that it happened, I said to myself, wow, I had never considered to be a physician prior to that experience. And I said to myself, what would it be like if I was the one to not only find the aortic dissected aneurysm in this case, but also fix it? And so the seed was planted for me to consider medical school. And over the course of many years, I took one class at a time because I had already started a family. So I had like this 15-year plan, believe it or not. The gray hairs may show for it if you can see those. So the journey began of taking classes a little bit at a time. Went back, did my pre-med, did my master's, and took the MCAT and applied to a number of schools. I had a low, I would say a mid-20s on my MCAT, which according to American standards isn't good enough, even though my GPA was like a 3.9 at a master's level. But because I had been out of school and I was a non-traditional and they wasn't sure if I could handle medical school, I expanded my options and applied to 4 or 5 Caribbean schools. And I was able to get interviews at 3. MUA was the cheapest, and I said, I hope I get into MUA, and long story short, here I am. So in terms of my experience at MUA as a basic science student, it was pretty awesome. I was one of the people who went to the island maybe about 2 weeks before classes had started, and I wanted to get familiar with the island. I was originally supposed to bring my family down. My wife was saying, we don't know if we want to travel to the Caribbean and live there and uproot the kids out of their schools, their current school situation, after we had already spent so many years preparing for this moment. So I decided to go solo and leave my wife and 3 children to pursue my dream. And it was very rough. Imagine calling home and crying, and your daughter is telling you, Daddy, I believe in you. You can do it. I know you can do it. Don't leave. Stay and study hard, Daddy. Stuff like that really helped me to solidify my purpose and why I was there, and really push through. During the initial first semester, I was able to get very familiar with the island, drove the entire island, which you can actually drive the entire island over the course of 25 minutes and make your way back, starting from one point, and make your way all the way around from one point to the other, believe it or not. It's a very small, quiet, perfect island for studying. And when you want to leave and go to do some recreational activity or relax, you can do that. I think that's what's really great about the island. It has like a downtown, so to speak, experience, and you can, and behind the school there's like this amazing ocean view that's always windy, that you can just stand there and kind of be one with the universe or God. Hi, Miss Sharon, how are you? This is the lady, Miss Sharon Doris. She was the administrator at the time when I had first started, and at that time I was all bummed out spending my first Christmas in Nevis away from my family, and I was locked in my apartment, and this amazing administrator invited me over for Christmas dinner. And I will never ever forget that, and I am forever grateful. My basic sciences experience, in brief, was really, really amazing. The professors at MUA, they sort of say, you have full-time professors. Dr. Crum would say, we have full-time professors that are there whenever you need them, and it's true. There are professors that are always accessible, always in their office, always willing to help go over some exams, show you something. There's one particular professor who became my mother on campus, Dr. Adutola, and she was that person for many other students as well. And whenever I had those moments where I was breaking down, thought I couldn't handle it or wanted to run away, she was that professor that said, nope, you can do it. Let's talk. Let me know what's going on. And she was very supportive to help get that done. In terms of the learning was really comprehensive. I felt that everything that I learned in MUA was exactly what I needed to prepare me for my clinical experience. And during the my clinical rotations, I felt very, very confident about what I had learned and applying what I learned. I think that one of the most important things that I learned in basic sciences was just learning how to study the material and carry it over in a practical sense. Because I'm an experiential learner, it helped me to apply those skills once I made it to the hospital, passed all of the exams. During the clinical rotations, once I passed all the exams, Med 1 through 5, take the comp exit exam, you make it over, you take your step 1 exam, which is a national board exam, then you do a research paper, a grueling but fun research paper that everyone must do before they are assigned clinical rotations. And once you complete that, then you get assigned to your clinical rotations and you start. And you're like, okay, I'm in the hospital, what do I do? And so fortunately for me and many others, the clinical rotations were scheduled in a sequential way that sort of built your learning. So I started off with pediatrics, which was a nice, easy rotation. You kind of learn all of everything you learned in step 1 or everything you learned in basic science, but for kids. And then I went into internal medicine. And internal medicine was the same, but for adults. And what really made that transition amazing was right during my internal medicine rotation, that's when COVID hit. And I was able to really demonstrate everything that I learned, everything that I was taught. And it was a transformative experience. There were times where people had to make a decision of, okay, do I stay? Do I go home because I don't want to get the virus? And I decided that, listen, I waited all this time to live this opportunity to take care of people, and I'm going to stay and do this. And it worked out amazing. I learned how to draw blood. I learned how to do ABGs. Because half the residents were out sick, I was jumping in, doing Foley catheters and Texas catheters and all sorts of procedures that I couldn't believe that I was doing. And I was it just came very natural to me while I was doing it. And as a result of that, the medical director heard about all the things that I was doing and asked me to write about some of my experiences that I had shared with him. And as a result of that, I was featured as a clinical student at another medical school. And then now MUA, I believe, is going to feature that article, a article of their own featuring me. And then as a result of that, I was able to put together some of the clinical stories that happened during the COVID, and I actually wrote a book called Pandemic 7, which was something I never dreamed that I would have the opportunity of doing. So that's pretty much me in a nutshell, going from before medical school to basic sciences to clinical experience, just a little bit, not to get too much about me, because I'm actually here to hear or answer any questions that anyone else may have, and share any additional. Tom, how are you? Very cool guy. That's pretty much me in a nutshell. I am excited to share my clinical experiences and some of the things that I've done and am currently doing, which is pretty amazing. Right now, as I mentioned, I'm in the psychiatric ward, and currently I am, as I mentioned, I was given an opportunity to operate in the capacity of a resident, and so I am seeing patients, making diagnoses, typing notes, and doing everything that a resident does, essentially under the direction of the director, which is pretty awesome. And so that's where I am right now. So if anyone has any questions, I am more than willing to give further detail. I didn't want to give too much detail about myself or the experiences that I've had, but if anyone has a question, I'll be more than willing to expand on that. So let's see. Okay, so when it comes to studying, I get that question a lot. I find that medical school studying is totally different from pre-medical school studying. You can get away with memorizing facts, understanding, but to really grasp the medical school experience, it's really more about taking your learning from learning the material, understanding it, applying it. But when I say apply, it's really more about comparing the similarities and differences between what you're learning. So this way you really grasp that, okay, if I learn something, how is it similar to other things that I've learned? How is it different? If I were to simulate myself or put myself in a situation where I had a patient, could I really recognize that? Can I see that? So that's the kind of thing that I think helped me adjust very quickly to the clinical experience outside of me having clinical experience before medical school. In terms of just one other piece that I didn't mention about my basic science experience, we not only learned the basic sciences of all of the coursework, starting from scientific foundations, which is no longer given, but it's like a foundational science and physiology course, and then you go through all of the microbiology, you go through pathology, you go through all of the organ systems, and then once Sir William, one of my mentors from Med 1, who was my mentor, who taught me how to master histology, is on the line. So that was another course. There's one of my favorite professors. They call her Dr. Machine Gun Mamta, because she rattles the information off so quickly that your head wants to sort of spin, but you learn to appreciate how expansive the human body is, and how expansive the knowledge is, and how amazing it is when you actually conquer that course and you're like, wow, I really could do this. I learned all of this, and now I thought it was just histology, but it's actually being applied to other subject matter. So the part that I didn't mention was, in addition to the basic sciences, there's clinical skills. So you learn about clinical skills, You learn about how to interview a patient and different types of patients, whether depending on the subject matter that you're learning, because there's different levels of clinical skills. So you may learn how to examine a patient for the heart. What do you listen for the lungs? How do you examine a patient's abdomen? How do you do a range of motion exam? Hi, Miss Brooks, how are you? Good to see you. This is a wonderful lady at the library that sits behind the desk, and when you sit down and for so long and you're studying and you want to get up and take a break and you're hoping that somebody can say something to you positive, she's one of those people. And that's one of the things I really loved about MUA. There was a student experience, and then there was this family experience from the faculty, staff, cleaning staff. I never forget, every time I went into an exam, there were a few cleaning staff people who would literally be standing at the entryway of the hall when you're about to go and take your exam, and they're like giving you the thumbs up and smiling and saying, you can do it, you know, I believe in you, and stuff like that. And not having your family around and not having people that are closest to you at home with you, they're going through this grueling medical school experience, it really was amazing to get that level of support. Just knowing I can go to the lady behind the library desk and just have a conversation and hear her tell me, hey, you know, you look a little down. What's going on? Talk to me. Hey, pick your head up. It's going to be okay. Just keep pushing. Get some coffee. Go to the cafeteria. Go for a walk and come back. That's the kind of thing that, thank you, Sir William. Appreciate it. You know, that's the kind of thing that goes on at MUA. You know, the professors, you know, they would really take an interest. I even had a professor look at me and say, you know, you look like you're losing some weight. You know, why don't you meet me for lunch or something? Because sometimes, you know, those days will happen where you think more about studying than food, and you don't realize it until somebody kind of calls you out on it and says, hey, you know, you're kind of losing some weight there. You may want to remind yourself to eat. You know, going through that whole medical school experience, I always said to myself from the very beginning that if I had the opportunity to give back, if I had an opportunity to share with someone what it was like to live their dream, I would want to do that. And that's why we're doing this discussion today. That's why we're talking today. You know, for those people who are aspiring medical students who want to go to medical school and have a dream to become a physician, you know, if there's anyone who could become a doctor, you're looking at them, because all of the reasons not to go back to school were in my card deck. You know, I was married, had 3 children, had a professional business. I had no reason to want to go back to school. Money was not a factor. It was just that burning desire that I couldn't seem to get rid of. And it all started, as I mentioned earlier, with that patient that I was doing an echocardiogram on, and he's laying on a table, he's giving me marital advice, and I'm asking him, you know, you've been married, tell me something that I should know before I get married. And he's giving me all this marriage advice, and I turn him to his side to get a better image of his heart, and all of a sudden he says like, ah, and I'm like, okay, you came into the hospital for chest pain, where's your pain, in your shoulder or your chest? And he's like, well, it was in my chest, and now it's like in my shoulder going to my back. And I'm like, wait a minute. Shoulder going to back from chest? The only thing that could be causing symptoms like that is something called an aortic dissection. And I start looking for it. And lo and behold, I found the lining of the aorta was tearing inside of this patient. And I literally left him on the table, got up, got the cardiology team to look at the video that I recorded, and they took this guy from the ultrasound table to the operating room, clamped him, and by the time they clamped his vessels, it ruptured on the operating table. And I was only supposed to be there temp. I wasn't even supposed to be there. I was covering someone on maternity leave. And the only thing that I kept thinking to myself was, was I supposed to be there? Why was I the one that did his echo? Why was it the case that I just happened to see him? And I didn't even know if he lived or died. All I know is that the blood vessel ruptured after they opened his chest. The only reason why I know that he survived is because about 8 months later, I got a stack of letters in the mail, and it says something like, Dear Cardiology Chairman, I'm looking for the young man who saved my life. I think his name was Jimmy. He was a young black guy. And the chairman is like, sorry, there's no Jimmy here. You must be mistaken. And then he sends another letter. I don't know what his name is, but I gave him marital advice. I told him all this stuff, and I'm not mistaken. And then the chairman realized, oh wait, there was a guy named Glen Ramsey who was there, who was covering temp. You can contact the agency. And 3 letters later, that's when I found out that this guy was trying to contact me and wanted to personally thank me for saving his life. And that was the first time that I realized that what I studied could actually correlate with helping someone or saving someone's life. And that's what initiated my journey to become a physician. And it was the best decision that I ever made. Yeah. So Sir Harry, this is the guy, one of the cool guys in the back of the classroom who, got all the young ladies excited and heart-throbbed while he demonstrated his knowledge. I'll never forget that. That was Med 5. Thank you so much. Thank you. We all have a story, right? We all have a reason why we're here, why we're pursuing our dream, and the overall objective is to find a drive, a match, a school that can help you to meet that dream. For me, it was MUA. I loved the fact that it was a small school. The faculty were personable. It was cheap. Among all of the other medical schools, it was the least expensive, which is very appealing to me, especially considering the fact that I have 3 children that I have to pay college for. So there were a lot of things that I researched about MUA, in addition to the fact that when after I was accepted, they gave me this packet, and inside of the packet there was all of these people who were MUA students who were chief residents at major hospitals like Drexel and all these, UPenn, Hershey, and all these major hospitals. And I said to myself, okay, if these people have gone to MUA, and hey Perun, if all these people can go to MUA and become a chief resident, then I can do it too. And so I know that I have the capacity to be a great physician. I just wanted to lock in with a school that can help me get it done. And I'm very grateful. And in fact, if anyone who knows me knows that I'm one of the super positive MUA ambassadors, if you will, because my way of giving back to MUA and saying thank you from the very beginning was when I was a Med 1 student. And when I was a Med 1, as I mentioned earlier, I drove the whole island. I figured out where everything was. People were like, where's my apartment? And I was taking pictures of where they lived and showing them where they're going to live and all this stuff. And this is this cool restaurant. And, this is the best place to get your fish curry or your garlic naan. And I found out everything there is to find out about MUA and all of the resources, and it was amazing. And because I was there 2 weeks early, I organized this thing called Meet and Greet, where the Med 1s kind of got together and we would kind of know who we were before class started, the official day of the year, which was the 2nd of January in my case, because I started January of 2017. And it was amazing. I got a chance to meet my classmates, know who's in my class. and it kind of helped to even out the anxiety about what medical school would be like, and it removed the competitiveness. We were laughing and talking the night before class, so that was pretty cool. And it was such a cool thing that we decided to do it every semester. And I think the last one may have been last semester. You know, it's still ongoing. Even though I have left the island, people are still continuing this spirit of camaraderie and getting together and having fun and getting to know each other before school starts, which I think is really important in terms of feeling the feeling of being alone on an island, and you're there with people who are sharing their own story and their own aspirations, and everybody is there to get to their dream, essentially. And so, you know, the overall experience was, for me, worth it. It was really worth it. I can't think of, I can go on and tell so many stories of how, you know, I was transformed not only as a medical student, but as a person. Just, it was the first time for me in my life that I actually had been alone. Believe it or not, I left my parents' house, bought my house, got married, had kids, and then was living with my wife and kids. This was the first time that I was actually alone in my life. And I don't know if anyone could relate to that, but it's very serious when you're alone and you're studying, and all you can think about is studying, and your mind is thinking of your family and if they're okay, and having a supportive faculty, having support groups like the clubs that are on campus, and having, you know, being in class and having the whole dynamic of being able to go and relax or go to the beach, that really made being there amazing. And so, you know, if I had to do it all over again, I would. I really would, because trying to study once I came back, you know, is very challenging. Like, to me, I didn't realize how much of a gift it was to be isolated on a beautiful island with the best Indian food ever. I actually wanted to go back. Actually, when I left and came home, I actually missed it, and I really look forward to the day when I can actually go back and bring my my telescope with a camera. I hope I gotta find a telescope with a camera, because the stars in Nevis are so beautiful. I've never seen sky like this anywhere in the world. Like, seriously, the stars are amazing on that island. I don't know if it's where the island is positioned, but for some reason the sky is always beautiful. So in addition to, you know, getting to the island, you know, the faculty, they meet you at the airport, they pick you up, they bring you to your apartment, you unpack, you get settled, you make friends, you get to know where everything is, they take you shopping, you get to find out where the shopping is, and everything is just super convenient. Everything is right where you need it to be. And if you want to go to the movie, you jump on a ferry, you go to St. Kitts, which is the adjacent island across on the other side, and you go to a movie, or you go hang out, or you go to see all the Marriott Hotel, which is awesome, right across the water, and it's cheap, so you can go there and have a great time. So yeah, that is MUA. Let me see if there's anyone else has any other questions. So I'm going to open the floor for questions now. For anyone else has any questions, any other clinical students have any other feedback about how to prepare for another pandemic, God forbid if this COVID thing comes back in the fall, what to do to prepare for it, how I prepare for it, and what were some of the things that I found helpful during that clinical experience I can share, if that's something that anybody wants to know. And let's see. Wonderful. Thank you. Thank you very much, Ken. Thank you. So, in terms of the clinical experience, I'll just speak a little bit more about that. When it comes to applying the knowledge that we learned at MUA, we learned a lot of information, right? And it's like, how do you apply what you learned? And I think the easiest way to express the application of it is really to say, I think one way to look at it is, we learned hard facts and we learned how to apply it, but when it comes to the application of it, there's always some minor tweaks. I think, for example, right now in the psychiatry department, everything that Dr. Mankoff taught us in terms of the personality disorders and the schizoaffective and all the different psychiatric diseases, wow. I mean, amazing job to Dr. Mankoff. I mean, he used to make jokes about this stuff and make it seem simple, but the patients really show up the way he described it. I mean, it's really amazing. Like, they'll come in and they'll tell you straight, yeah, I was down, I was depressed, and I had this episode, and I tried to kill myself, and then 2 years later, I started hearing voices, and you're like, oh my God, that is like classic schizoaffective. So just stuff like that. In terms of, heart murmurs, I never forget when we were on the island, we finished basic sciences, or we were Med 3 or Med 4. MUA has this awesome thing where they allow you to go to the hospitals in Nevis, and you see patients there. And I never forget the first time that I went there, I was able to see a bunch of x-rays on the computer screen, and then the attending physician at the hospital had showed us the chart, and I was able to go through the chart and look at the EKG and see that, wow, this patient has inflated T waves. Wait a second, the potassium must be high. What kind of symptoms is this patient having? And I'm going through all of the clinical things that I learned in school, and I was able to actually confirm all of my suspicions just from an EKG. And that's something that we learned straight away in class. And so that's just another example of applying the clinical knowledge to everything that we learned. So I'll just check for one other question, and then we are going to prepare to close. 1 second. So I'm going to open up the floor for questions for another minute, and then if anyone has any questions, you can ask away. I am more than willing to answer them. Ken, is there anything else that you think would be helpful for me to mention about my experience, or anything that would be helpful for these potential MUA students? Have I covered all the bases? Great question. So one question asks, how did COVID affect me? Wow. So it affected me in numerous ways. First of all, as I had mentioned earlier, I was one of the people who made a decision to actually stay in the hospital and continue doing my clinical rotations in the midst of like truckloads of people dying, and residents getting sick and calling out, and they're being short-staffed. So I was in the hospital, and I was basically living here. I was literally afraid to go home because I was afraid that I was going to give this virus to my wife and kids. And so I kind of Airbnb'd I was given a room in the hospital to sleep in, and I just worked almost around the clock, responding to codes, you know, working with the resident team as part of the resident team to treat patients. I was working on a floor called the COVID. It was a dedicated COVID floor. So this floor was a detox floor, like where patients are detoxifying from substance abuse, and they cleared the entire floor with no oxygen line and made this a COVID floor. So imagine this: you have about 20 patients on a floor, no oxygen line, and me and 2 residents and the nursing staff are going to each and every room, making sure that every patient's oxygen tank is full. And we're checking for vitals, checking for oxygen saturations, checking for oxygen tank being empty or full, or kind of timing it and developing a system where, like, oh my God, this patient, we need to turn it down a little bit, because if we don't, this is going to run out before we get a chance to circle back. So let's find that sweet spot of keeping the patient on oxygen while not letting it run out. And then learning so many clinical skills, that even things that we weren't even taught, or we were taught, but I didn't realize the significance of it. Like something like as simple as sodium level and dehydration. We learned this in basic sciences, but to apply it to a patient who has COVID and understanding what a virus does to a patient was absolutely amazing, because everything that I learned was coming back, but it was coming back in a practical sense. Like, yeah, we learned that viruses have the ability to reduce your blood volume and make your blood volume lower, but how does that affect the patient? Well, wait a second. If the blood volume is lower, the blood is going to move faster in a physiological sense, but what does that really mean for the patient? That means that they're going to be more susceptible to having a stroke, because the blood is moving faster. And if the patient's hypertensive, on top of having COVID, now you have patients who are stroking. Now you have patients who are diabetic, for example, and a diabetic patient who has COVID, they have pseudo or fake blood sugar levels because they're dehydrated. Their blood sugar levels appear to be high, right? Then if you make a mistake without realizing and you give the patient insulin, you actually make them hypoglycemic excessively and put them in a coma state. So it was a very interesting clinical experience, because we actually had to become masters of understanding how to manage a COVID patient. So it made me very meticulous. It made me very, very systematic in my thinking, and it caused me to constantly think and go back to what I learned at school and how can I apply it now, because obviously I didn't have time to study, right? So I had to take what I already knew and apply it. Like, for example, while we were in the middle of treating COVID patients, something happened, and I talked about this in a book that I actually just released on Amazon called Pandemic 7. And while we're on the floor, an employee who was cleaning beds overexerted himself, cleaning all the beds, helping out everything, and develops a massive heart attack in the hallway on the COVID unit. And imagine being in a situation where the chief resident leaves to go to another floor and rounds, the junior resident is in the bathroom, and the nurses come running in saying some guy's having a heart attack. You run out in the hallway, and this patient or this employee has a blood pressure of 210 over 114, hyperventilating, grabbing his chest, and the nurses are looking at you like, okay, so what are we going to do about this? Right? So how did COVID affect me? It made me cavalier. Because in that moment, I had to make a split-second decision without even thinking. And the first thing that came to my mind was, we need nitroglycerin. Please put 2 under his tongue. And the nurse came. She put the nitroglycerin under his tongue. We got the oxygen. We put him on oxygen. Me and 2 nurses literally ran the guy down to the emergency room ourselves and got him to the ER, where they were able to stabilize him and ship him out to another hospital where he was able to get cathed. So that was just one of the few crazy situations that happened clinically, that if I didn't receive the training that I had gotten from MUA, I would have not known what to do. But in that moment, it just came so natural, and I was literally shocked that I was able to just, without thinking, just apply everything that was in my head that I didn't know was there, but it just came out. If you can give any advice for married couples to keep communication when they're apart, what would that be? Wow. I think the best advice that I can give to keep communication for a married couple when you're apart is to think of spending quality time with each other. Thank God they have this Skype, they have Zoom and all these things, and you do have internet. I was very big on edible arrangements. I would send like random fruit and chocolate to my wife's job, because she actually went back to work after not working for like 15 years. So she became the breadwinner of our house, and so I just, let her know how much I was grateful, and I found support systems to let her know that. So I would ask my mom to drop off something, or I would ask my cousin to do something to support my wife or support my children, to let them know that even though I'm thousands of miles away, that I'm still thinking of them. I may not be physically there, but I was there in spirit. And I think for me, I can't speak for anyone else, but faith is a very foundational part of who I am as an individual, and that helped to facilitate the communication, not only between us, but communication between me and what I believe, and how I can utilize that to strengthen our relationship. Being apart is never easy. It's very challenging to be apart from your family in the midst of all the studying that's required. But when you have some family that are supportive, when you have a supportive wife, and who could really understand what you're going through, and you can convey that without taking it out on them, but sort of just share what you're going through so that they understand, because I don't think anyone really could understand what it's like to be in medical school until you're in it, really. But it's doable. I came back home, I had to relearn my kids all over again, but we got back to normal. We got back to normal. Would you recommend using materials such as first aid as early as Med 1? Absolutely. Oh my God, that is probably one of the biggest mistakes that I made. Because a few upperclassmen was like, you don't need first aid, you're not going to need it until you get to Med 3. Man, I waited until Med 3, and yes, everything came together in Med 3, but OMG, the stuff that was on Med 1 anatomy final was in first aid. And how much of an idiot I look back at myself, and I'm like, why did I even listen to that? Micro, all of the stuff that was showing up, that showed up on previous exams, was in the first aid. So yes, you need to become familiar with first aid. Now, when it comes to utilizing first aid is not just first aid. Like, there's a reason why people say don't use it, but they misconstrue the usage of it. So first aid is not a book. It is it's a personalized guide for your medical education. So it's essentially a summary of everything that you're supposed to know, the highlighted stuff. But when you do your practice questions, you go to the respective section of the first aid and you annotate what you learned from the question. Now, some people just dictate the questions in the book. You can do that too, if that's how you learn. But for me, as an experiential learner, how I learn best is I ask myself, okay, what was the lesson to be learned from this question? The question asked, okay, what is, a Baker's cyst? But in the answer choice, they gave, a blood mass, they gave a cystic mass, they gave a solid mass. So when you really look at the question, what the question is really asking is not really what's a Baker's cyst, but the question is really asking, how do you differentiate a cyst, which is a fluid structure, from a solid structure? And as you go on through your medical journey, you'll realize more and more that every question, especially down to the final comp exam, they call it, comprehensive exam, it really boils down to differentiating the similarities and the differences. And the faster you are at identifying what the question's asking, the easier you'll be able to answer questions. Because most of the time, the questions are thinking. They're testing your ability to think and your ability to differentiate the information that you learned. And so if you can constantly ask yourself, okay, I learned this, okay, and then where have I learned this before? Or wait, I learned that. How is that different from this? Oh, wait a second. This is a disease that happens in children. Is there one in adults? Is there one in older people? What does it look like then? How does it play out there? And if you can get in a habit of developing these type of clinical questions, it'll make your life easier because you can compound the knowledge into one package. So then it'll be like, here's a cyst. There's cysts in kids, cysts in women, cysts in elderly people, and I have in my head, if I hear the word cyst, I could think of 10 different ways that a cyst manifests itself. And if you can do that, that'll simplify your energy of trying to memorize a cyst separately for all of the different subjects, all of the different subject matter and systems, because you understand. It's very interesting. This is my director of psychiatry calling me. One second, hold on. Hi, Dr. J. I am going to be here maybe about till 8:30. So there's an urgent, I'm sorry, one second. Hello? Answering. Okay. So is there something you need me to do with her? Should I check on her or bring her back? Oh, she's back already. Okay. No, I'm actually just doing a live. I'm doing a Facebook Live, but I'm going to be done like in like 20 minutes or so. Yeah. Okay. Dorazine 50 out of N2. Okay. Okay. I am both. Okay. Okay. Got it. All right. So I'll check with the nursing station in about 15 minutes, and I'll verify, and then I'll take care of it. And I'll put the order in now. All right. Thank you. Okay. All right. I'll wait. All right. Thank you. Hi. So, can someone just say hi? Okay, I'm glad. Okay, great. I'm glad. Thank you so much for understanding. So we just had an emergency situation with a patient, and we just had to make some preparations that when the patient comes back, we know what medications to give her, and that's just the typical thing that you would be expected to do if you would be trusted to make those kind of decisions and execute them. So essentially, I hope I answered your question about utilizing the first aid, James and Joyce. I hope that was helpful in answering your question. There are endless pieces of advice that people will provide to you in terms of how to study, what to study, when to study. And this is a very, very controversial topic but the thing that you must know, if I must say this, is that please understand that you must apply your method of learning and how you learn best. Because I may be a visual learner or audio-visual learner, and what comes natural to me comes by looking at it and then listening to it. But thank you so much, Ken. Really appreciate it. But another person may be a kinesthetic learner, where they would need to, write out what they're learning. And so, being on an island alone, you're welcome, James. Being on an island alone, it becomes very powerful because you get a chance to be one with yourself and really understand who you are. You really solidify your passion as to why you're there and what you can do to be your best. And when you kind of lock in with yourself and you realize, okay, what worked in the past? What did I do that made me successful? Let me try to apply those things. Eventually, you will tweak and twist until you find that sweet spot, and you'll learn what works best for you. But regardless of how you learn the information, the most important aspect of learning it all is applying it. Because if you can apply and teach what you learn, then executing it in the ways that I've been fortunate enough to do will come natural for you too. Because there's nothing worse than memorizing information and having it all in your head and being able to select an answer choice, and then you get to a patient and you're like, wait a second, it's not like there's an A, B, C, D patient. There's only one patient, and I need to make a decision, or I need to decide, or I may be on the floor, which I have been, and the director of surgery walks by while we're doing a medicine rotation, and he says, what are all you guys standing here doing? And we're like, we're waiting for the attending, and he's like, well, I have a few questions for you now, since you want to sit here and hang out in the hallway. What's the healing process? I cut a patient open, and they need to be healed. What do you do first? How do you wrap a wound? And all of a sudden, you realize, oh my God, I got caught, off guard. And these things will happen. They call it pimped, where any doctor, anyone could just question your knowledge, and you are not expected. But if you don't know something that could be very simple, it just doesn't look very good. But if you do know it, it looks excellent. Exactly, Joyce. So could you imagine being, on an internal medicine rotation, and the director of surgery walks by and says, what's the first stage of hemostasis? And you're like, I know I learned this in Med 1. Please come back to my mind before I go into palpitations in front of the director. Yeah. Any other questions? Let's see. Thank you so very much. Thank you. Let's see if I missed anything. So, one of the things that I found was very, very helpful and inspiring, in fact, was that the medical director at the hospital where I'm located, he advocated for the students to be at the hospital during the COVID experience, and he firmly believes that medical schools should prepare the students to anticipate a pandemic or a situation where a patient would be coding every 15 minutes and their hearts are stopping, or they're desaturating on oxygen levels below 80 and going into respiratory failure. So what do you do in those situations? How do you respond, or how do you react with the knowledge that you don't have time to think about? So these are the type of things that he believes medical schools should be preparing their students to do, and I think MUA did an excellent job in preparing us and preparing me to do that. So the question is, if you're out there and you're at your clinical rotations now, are you ready? And if there's any question of your preparedness, now would be a good time to ask a question if I haven't already answered it. Okay, so I hope this was helpful. I actually have to run and take care of this emergency patient right now. So I'll count down to 10, and if anyone doesn't have a question, I'll just let this close, as it was a pleasure speaking with you, sharing. I hope this was helpful. If you choose, or when you choose MUA, I am sure that you will gain as much or more than I did. I am truly forever grateful for MUA and them giving me the dream to the opportunity to live my dream as a physician. One last question. What is the best way to stand out during clinical rotations? Dr. Andre, how are you? What is the best way to stand out during clinical rotations? I think the best way to stand out during clinical rotations is to, first of all, cover the basics. What I have noticed is that there are two different types of students. There are clinical students who come to rotation saying, I just want to come in, stay for a few hours, and leave and go home and study for my step 2. Why do I have to stay here? I don't want to, do that, or, why do I have to wait? And you'll always, thank you. You'll always find people who will present a pessimistic approach or way of thinking, and their thinking is, for lack of a better word, limited. And so they limit their opportunity, they limit their experience, they limit their exposure, and then they wonder why they aren't granted the opportunities to excel. So I think I was fortunate enough to stand out. I did excellent on all my clinical rotations so far, and everybody has different strategies on how to excel or stand out during clinical rotations, but one of the things that I did was I showed up early and I leave late. And before I even show up on the floor to see patients, I have already gone to the library and looked up every single patient that is on that unit. And I have I have an awesome clipboard that I got from Amazon that I make my notes, and I literally chart every single patient. I know why they were admitted, what's the clinical diagnosis to date, and what is their current treatment plan. I go through their labs, and I basically make every single patient a case study. And so by the time we get to the floor and the attending is asking questions, so why do you think this patient has this? Or what do you think this patient has? I know every single answer. Because I came early, I charted every patient, and even if there was something that I didn't know, I could figure out what the answer is, because I already know the clinical scenario of what's going on with this patient. So the patient comes in, they have right upper quadrant pain, and they're vomiting, and they have back pain also. The first thing I'm going to be thinking is, okay, wait, is this gallbladder or is this pancreas? Okay, so now I'm going to the liver enzymes that we learned at school. Okay, is the AST, ALT high? Okay, I'm checking, did the patient have an ultrasound done? DM, how are you? Was there an ultrasound exam done? And I check to see, and I run through all the clinical scenarios in my mind with the patient file to make a diagnosis before I even get to the floor. So by the time I get to the floor and the attending is like, this patient has back pain. He doesn't mention the right upper quadrant pain because everyone knows right upper quadrant pain is probably gallbladder, right? So he doesn't say that. He says, okay, so we got a patient here who presents with back pain and vomiting. What do you think it could be? And I'm like, ha ha ha. I just wait for everyone to give their answer because I don't want to, when you're at clinical rotation, sometimes it's not good to etiquette-wise, it's not really good to be a gunner, so to speak, and yell out all the answers. So it's nice to let other people share in the knowledge sharing, so that you're not standing out by outstanding other people. You're making it a team effort, and you're letting it be that other people give answers, and if no one gets the answer, then you can be like, okay, it's gallbladder. Stuff like that. So I think being humble is a really good way to stand out on clinical rotations. Not falling in cahoots or associating with pessimistic people. Coming early and staying late is critical. And just doing your best. Just do what you came to do, right? You went through all of this hard studying, late nights, you did your best, you studied your butt off, and at this point you have an opportunity to show who you are, regardless of what your score is, or regardless of what people say. They may say, oh, I didn't do too well, and they let their score dictate their performance on their clinical rotation. Are you serious? You must embrace your strengths, whatever they may be. And so you focus on doing your best in everything that you do, and the rest will take care of itself. In my situation, I was able to, excel. Even though I was at a pediatric rotation, for example, I actually went in the emergency room and covered the ER because there was a pediatric ER. So we were on the floor, and I'm like, well, if there's peds on the floor, may I go to the ER and do peds ER too? Sure. Went and did peds ER. Then while I was in the peds ER, the same PAs that were covering the peds ER were covering fast track. And they were like, wow, you were really helpful. You went in, you helped us type the note, you went and got the patients for us. Wow, could you help us in fast track? So now I'm being invited over to fast track, and now I'm seeing patients in fast track on the floor, pediatric ER, and they're like, holy crap, this guy, he's everywhere. He's doing a lot of stuff. And it got to the point that not only was I helping them, making their job easier, but then they were like, well, hey, you want to type the note? Could you type the note too? And I'm like, yeah, I know how to type notes. We learned that at MUA. So then I went in and started typing the notes for the clinicians, the PAs, the attendings. And they were allowing me to type their notes. And because we went in and typed the notes quick, and I was able to assess the patient and go through my mnemonic that we learned in clinical skills at school, I blew through those patients and typed my note. And they were literally like, hey, we got 10 patients here, we're overwhelmed, could you come help us out? Could you come see 3 or 4 patients? Seriously. So if you want to stand out, that's my recommendation. Do things like that. Dr. Andrea, are you in clinicals right now? If you have any questions clinically, let me know. I'm like an unofficial COVID expert from all the patients that I've seen while I was at the hospital. So anyone has any questions whatsoever regarding clinical skills, clinical experience, COVID testing, fire away. I'm about to take care of something clinically. So that I gave one person an opportunity to give one question, and they gave it. So I think that will be the last question. I'm going to give it 1 more minute. If anybody has a question or any comment, and then I'm going to close so I can run and take care of this patient. My pleasure, David. My pleasure. I hope that it was helpful. DM, keep studying. Keep studying. I know you're making us proud. So on that note, thank you all for your time. Thank you, Ken, for your support and your encouraging words. Thank you, MUA, for giving me the opportunity to live my dream. And until next time, so long.